I'm Dr. Brent Barlow, naturopathic physician in beautiful Kelowna, British Columbia. Prolotherapy is a therapeutic technique designed to stimulate the body's immune system to regrow and regenerate ligaments, tendons, and other types of connective tissue. These are often overlooked tissues in the body. We often think about muscles holding things together, and when we have tight muscles, we have to loosen up these muscles. But in many cases, what's going on is we've actually had damage to these other soft tissues, the ligaments, tendons, and other forms of connective tissue. And they're the scaffolding that hold the bones and the joints together. When those tissues get slightly torn, they get overstretched, we get this laxity and this excess movement within the joints. And that will alert the nervous system and cause the nervous system to somewhat freak out and send signals to the muscles to get really tight in order to guard and stabilize. So again, the function of these ligaments, tendons, and other types of connective tissue is to stabilize the joints so that muscles can do their job, which is to move the joints around so that we can raise our arm up, we can turn our head, turn our back, do shoveling and do sports and things like that. So how does prolotherapy work? Well, prolotherapy is an injection technique where we inject a sugar solution. Typically it's a dextrose-based solution mixed in with various type of anesthetic like procaine or lidocaine. And usually most of us will use vitamin B12 in the injection as well. The solution itself isn't really magic. It's the injection technique where we really have to be precise with the needle. The needle contacts the damaged ligament or tendon and stimulates a new injury. The white blood cells will come to the area, and those types of white blood cells are called macrophages. The macrophages will see the new damage on top of the old, and that will alert the immune system to send in the fibroblast cells. Those are the cells that really do the magic, and they regrow the damaged tissue. Most prolotherapy sessions are spread out about 3 to 4 weeks apart, and that gives the best inflammatory healing response in between those sessions. Most people need somewhere between 3 to 6 prolotherapy sessions in order to get optimal improvement and best function. So how do you know when to stop doing prolotherapy? Typically we're getting somebody to about 90–95% improvement for the average person. And once we get there, we're pretty sure we're going to get as close to 100% as possible. So that might be 3 sessions for some people, it might be 4, 5, or 6 for others. A really important note with prolotherapy is prolotherapy works best when we're working with chiropractic, physio, massage therapy, or other techniques that help in between the sessions with rehabilitation, the use of our muscles and our joints as well too. So I hope you enjoyed this introduction on what prolotherapy is and how it can work. I'm Dr. Brent Barlow, naturopathic physician in beautiful Kelowna, British Columbia.